Hey, Dr. Tracy, I'm a board certified general pediatrician. I work in primary care, and I want to address a common frustration from parents, which is your child is sick, they've got a fever, a cough, a runny nose, a sore throat, they've been up all night, they can't eat and drink. You take them in to see a provider, and you're told nothing is wrong. I know that's not the wording that we probably always use. I don't, but that's what parents are taking from what we're saying, and that doesn't feel good. So let's talk about why that might be your interpretation of what we're saying. What do we mean, and why is this so frustrating? So, what we mean when you bring your child in and they have all of those symptoms, and we say everything looks good, or nothing's wrong, or it's just viral, which people take as meaning that there's nothing is wrong, we mean that we don't see any complications from the virus itself. It doesn't mean your child is not sick. It means that we don't see a bacterial ear infection, bacterial pneumonia, or viral pneumonia, meningitis, dehydration, signs of sepsis, or something that is really highly communicable to other people and dangerous, like measles or chickenpox or something like that. So we're not saying they're not sick. We're saying that it is a self-limited upper respiratory infection at this time, meaning that you only need to do supportive care and watch for worsening symptoms. Most viruses, the body is going to be able to fight off in 3 to 7 days. After the 3 to 7 days, if you start to see worsening symptoms, that's a little bit of a red flag for a bacterial infection or a complication from the virus. So another frustration that parents feel is that a few days later, they saw their doctor, and their doctor said, everything looks fine, I don't see anything wrong. And then 2 to 3 days later, your child is worse. You go back in, maybe you're having to see someone else who can't really speak to what happened a few days ago. And they're now saying, there's this complication, there's an ear infection, there's pneumonia. And you're feeling like, well, I was just here a few days ago. Why couldn't we have handled this then? Because now my kid has suffered for several days. Parents have missed time off of work. Their child has lost weight. I mean, I get it. You can't prevent a complication from a virus by doing anything early. The only thing you can do to prevent a complication from a viral upper respiratory infection is to have your child vaccinated for Haemophilus influenza and strep pneumonia, which are the two main bacteria that cause complications. So I hope that helps a little bit. Please understand that our kids have had to have these viruses too, and we have to sit there and watch them be sick, and it's miserable and we hate it. But we also know we have the knowledge to understand it, and I can look in my kids' ears in a few days and take a look at them. I can listen to their lungs. I can assess for dehydration. So I can imagine how frustrating this is for families when they don't understand what they're looking for. Utilize your pediatric nurses from your pediatrician or family practice offices. They have a lot of education on how to screen for complications for viruses, give you advice, let you know when to worry, when to be seen again. So please take them up on it. They're not trying to keep you out of the office or keep you away from your provider. They're trying to give you medical care over the phone for something that may not necessarily need to come in just yet. So I hope this helps a little bit. I hate it when families feel dismissed from medical care because that's not how it should be. It should be that you understand it as best you can. When you leave the office, it's a team approach. You feel like, nope, I've got it. I know what to look for. I can get back in touch with my doctor if I need to, and they have my back. So that's our intention. That's what we want. If you don't have that, find someone that you feel like you can have that with. Take care.